So, good afternoon. Thank you for joining us for this press conference, jointly sponsored by the Virginia AFL-CIO, the Legal Aid Justice Center, and the Virginia Interfaith Center for Public Policy, where I serve as the Executive Director. We are here today to talk about the emergency temporary standard proposed by the Governor and the Department of Labor and Industry, why it is needed, where we are in the process, and why we need a standard, not just suggestions. We will hear first from some workers who would be affected by the standard. Joyce Barnes, who is a home health aide who has worked in home health care for more than 30 years, directly for Medicaid recipients and through home health agencies. She's also a member of SCIU. David Walrod, who is a math and special ed teacher at Lake Braddock Secondary School in Fairfax County, an executive board member of the Fairfax County Federation of Teachers, and a member of Governor Northam's work group on reopening schools. He's just finished his 11th year of teaching. We will then hear from Deborah Talley, who works at Boar's Head in Petersburg and is a UFCW local shop steward. We'll then hear from two of the strong Virginia advocates for this standard. Doris Crouse-Mays is the president of the Virginia AFL-CIO, and she's going to explain really why all workers need this standard. Yarashes is the lead attorney and program coordinator for the Virginia Justice Project for Farm and Immigrant Workers at the Legal Aid Justice Center. He's going to share a history of this proposed standard. And then we'll hear from Deborah Berkowitz, the National Employment Law Project's Worker Safety and Health Program Director, who served with OSHA as Chief of Staff and then Senior Policy Advisor for 6 years. Debbie is clearly one of the top workplace health and safety experts in the nation, so we've asked her to explain why CDC guidelines are not enough and why Virginia needs an enforceable standard. And finally, to wrap it all up, we'll hear from Delegate Jeion Ward from the 92nd District about why legislators believe we need such a standard. Delegate Ward chairs the House Labor and Commerce Committee and serves as a member of the Black Legislative Caucus. We'll then take questions. Destiny Levere and Roberta Oster, our communications experts, will help you ask questions. So we want to start now hearing first from Joyce, if she's on. Joyce, are you on? Okay, I think we're going to switch then to, we'll do David next. David, can you share with us?
Hey. Hello, I'm David Walrod. I am a special education math teacher at Fairfax County with Fairfax County Public Schools. We want schools to be open. We want schools to be reopened, and we want our students to be back in the environment we know they learn best. But we need there to be proper science-backed safeguards for teachers, support staff, kids, for our families. We need clear standards that provide worker protection. We need standards that will protect teachers, keep support staff, custodians, our bus drivers, clerical staff, food service workers, instructional aides. We need all of these people kept protected from COVID-19. The Virginia OSHA Standard would require strong safety protection for our staff in schools. Our school systems would have to implement COVID safety plans that we know are effective, and our school systems would have to ensure that these measures like physical distancing, the right kind of masks, training, reporting of infections in place. As of right now, the plan in Fairfax County, teachers have been told that we should start stocking up on PPE equipment ourselves for students because the district might not provide that to us. Science tells us that schools will be high risk for settings for the virus to spread. Documents from the CDC are showing that they consider schools at the highest risk. Any loophole that allows the education system to be less protective than other workplaces is unthinkable, places our lives and our community at risk. This is especially troubling after the recent announcement from President Trump that the federal CDC guidelines for reopening schools should be weakened. Governor Northam understands the importance of keeping us safe because he understands the virus isn't going away anytime soon. He knows we need strong protections to keep the virus under control and prevent additional outbreaks in Virginia. The OSHA standard being created in Virginia is the step that we need to help make our schools safer. a standard with no loopholes for employers, a standard with strong, enforceable protection for teachers, support staff, students, families, for all the relevant stakeholders involved in the educational process.
Thank you so much, David. Deborah.
Yes.
Deborah Talley, could you share with us as well now?
Well, on my job at Boar said, we have signs on the floor for social distancing. They have the plexiglass barriers so that you can distance yourself from others in your work, different depending on what job you're doing. I mean, they're following all the procedures that they should be following, and we feel pretty safe. Right now, I'm trying to get them to do testing for the employees so that we won't have to go out and get tested. Do testing here. It'd be easier so that way if somebody got it, we can know right offhand. You know, we can be told, okay, you can take them out of the job right offhand instead of, you know, they coming to work, getting sick, leaving, and then then you post someone has it, but you know, which I understand the privacy part, you can't tell the names. Board said it's pretty much doing all that they are supposed to do according to the CDC, and every day I stay over myself and write down all the touch points and stuff like that. We make sure everything is clean. We really push hard to keep this practice going, but it's safety of ourselves, our families, and our coworkers.
Deborah, thank you so much. I want to turn now to Doris Crouse-Mays. Is it just these two sectors, or would this standard help others? Go ahead.
Yeah, it'll help the whole state of Virginia, all of the workers in Virginia. You know, this was just an example of, you know, the meat and poultry and teachers, but we have nurses both in home and in facilities, nursing homes and hospitals. And what about when we get on that bus to go to work for our public transportation? What about when we go to the grocery store to buy our food, which is our food source? What about when we have to travel and we're at a hotel, or we go to a restaurant to eat? All of these workers and everyone that we come in contact with every day is impacted by this. And if we do not keep our workplaces safe, that is going to impact their communities and our families. Because when somebody goes to work, they come home and they're with their family and the community, and then they go back. So we've got to do it there. Also, manufacturing jobs, whether it's, you know, manufacturing of a truck or a car, or, you know, any type of equipment, or manufacturing anything. Every worker in the state of Virginia is impacted by this. And we really need to have standards, not just guidelines, because guidelines change so frequently, and we really need that standard. And the Virginia AFL-CIO, we really thank the governor for doing this directive and everything. So we appreciate that. But we have to keep all workers in the state of Virginia safe.
Thank you, Doris. And Jason, could you tell us a little bit of the history on this proposed standard? Where did it come from?
Yeah, thanks so much, Kim. And so really, I want to give an initial thanks to Deborah and David, because it really speaks to the fact that from the start, this has been a worker-driven and worker-empowered movement of folks speaking out to say, hey, look, we have not felt safe in the workplace. And that happened in the initial phases of this emergency, within an emergency, and that has really continued till today. Because while we have heard it improved standards at a lot of places or improved conditions, we have continued to hear a lot of issues at other workplaces. And what this has tried to do is to say, hey, look, there is an enforceable standard. This started by workers coming out, speaking. There was deep community organizing. There was a lot of media attention that was put to this in Virginia and elsewhere. And Governor Northam stepped up. He's a doctor. He recognizes these issues. recognizes the fact that in order for this to really have some teeth to it, it has to be an enforceable standard. We can't give enough credit for him reaching out to the Department of Labor and Industries, them taking the time to draft these really comprehensive, important standards, and that the Safety and Health Codes Board is now taking the time to consider those on a fourth arduous day of hearings. And we're hoping that Wednesday is that fourth final hearing where they get things, a few last things to be corrected, as well as push forth to the final vote and get these emergency standards with enforceable standards finalized.
Thank you, Jason. So Debbie Berkowitz is one of the leading worker health and safety advocates in the nation. She worked for OSHA. She did health and safety for the UFCW. So Debbie, explain to us why the CDC guidelines really aren't sufficient.
Thank you, Kim, for that nice introduction, and thank you everybody for being here. And I also want to thank the governor and thank the Virginia OSHA agency for proposing this very important emergency temporary standard. It is critical that Virginia protect workers from the spread of COVID-19 at work. This will assure that not only workers are protected in Virginia, but their families and their communities. Because if we don't provide concrete steps for employers that they must take to protect workers, then it will spread back out into the community. And nowhere is this more evident than in Virginia's poultry industry, where over 1,000 are sick and 10 are dead. And we don't know all the numbers because they haven't released all the numbers. I want to focus on the CDC guidelines for a few minutes to just explain to reporters why it's a false equivalency to say complying with the guidelines is equivalent to complying with all the requirements in the proposed Virginia OSHA emergency temporary standard. First, the proof that these guidelines are weaker and that they don't protect workers is just the rampant spread of COVID-19 in our meat and poultry industry, and that it continues to spread all through the nation, with now over 35,000 that we know of workers in meat and slaughterhouses with COVID-19, over 150 dead that we know of, and we know there's more because many states aren't reporting. In this pandemic, the CDC uncharacteristically wrote their guidelines in a way that makes them unenforceable. I know this because when I was at OSHA in 2009, they wrote very specific guidelines for H1N1 protection for healthcare workers. That was all about must and all about if they couldn't do this, then they have to do this. But the current guidelines, because they were really written not just with science in mind, but with politics in mind, is they're full of loopholes. There are no shalls or this is required. In fact, Virginia OSHA itself said in the background document to the standard, and you can look at that document, it was the background document. They looked at the guidance for meat and poultry slaughterhouses and found that shall is never used. Much is used 8 times, but mostly with regard to OSHA regulatory requirements for other non-COVID related standards. Rather, should is used 56 times, may is used 39 times, recommend or recommendation is used 7 times. That's from the state agency. And the best example I can give you, because the guidelines are spread out over like 10 web pages, so good luck finding them all. But the meat and poultry guidelines are easy for you to find from CDC. And let's look at social distancing and what they require. You and I know that the gold standard in mitigating the spread of COVID-19, if you're indoors or even out in the public, is 6 feet apart, right? Is social distancing. And that's why in the grocery store, when you go in, there's a marker of where to stand. That's why they're limiting the number of customers in grocery stores and other workplaces. Is why we're spread apart in outdoor restaurants. It's why you and I are teleworking. So if you look at the meat and poultry guidelines, CDC's website does say that the #1 risk factor for meat and poultry slaughterhouse workers to protect them, or the #1 risk factor for them getting COVID-19 at work, and why it's spreading in the plants, is that the workers are required to work close together on the lines, shoulder to shoulder, and they're required to crowd into break rooms and locker rooms. Yet the guidelines that CDC wrote say to the meat industry that only if possible, if feasible, if it's ideal, you should separate workers 6 feet apart. And we have evidence, written evidence from meatpacking companies, you know, some of who are in Virginia who say, well, we're in compliance with CDC guidelines because we decided none of those things are possible. So we're in compliance. A further piece of evidence on the failure and weak nature of the CDC guidance to protect workers is a recent CDC report called an MMWR, Mortality and Morbidity Weekly Report, on the outbreak in meat and poultry in April and May in this country, where they looked at the measures that companies, meat and poultry slaughterhouses have implemented to protect workers. And it doesn't mention social distancing at all. CDC guidance is not the equivalent of what's in the emergency temporary standard right now. They are weaker, they are filled with loopholes, and they're not a substitute for the language in the Virginia OSHA proposed standard. Thank you.
Debbie, thank you so much for making that clear. We're going to go back before we hear from Delegate Ward. We're going to go back and hear from Joyce Barnes, who finally made it on.
I finally got on.
Excellent. Well, Joyce, tell us why we need a standard here in Virginia.
Well, to me, and this is how I feel about why we need a standard, because they didn't prepare me for anything when this COVID-19 came out. I was not prepared. My patients were not prepared, and they never gave us guidelines or what you're supposed to do. And then they say, well, you know, you're 6 feet apart. But you know, when you're doing home care, it's hard to be 6 feet apart working with your patients when you have to lay hands on. And that's a very hard thing to do. And also, you know, they didn't prepare me for anything. We didn't have the PPE. We didn't have the gloves. We didn't have anything. And I just went in with a blind eye to do the best I could with my patients. You know, I was given masks through the union. They gave us masks. I went out, I bought gloves, hand sanitizer, but not much were given to home care workers with this, you know. And you're going into someone's home and you're coming from the outside. I have not been tested for it. I don't even know if I have it or not. No one's been tested. And you hoping and praying that these people don't get sick. Even though I go in the house and I mask up, I glove up and everything, it's actually hard. It's a hard job to do when you really have to lay hands and do things for people. It's really, really hard.
It is hard. Thank you. Well, Joyce, thank you for sharing that. And now we want to hear from Delegate Jeion Ward from the 92nd District, who chairs Labor and Commerce Committee, and is also just a real leader in Virginia on worker rights issues.
Thank you, and good afternoon to everyone. You know, as a state legislator and as the chair of the House Labor and Commerce Committee and a member of the Virginia Legislative Black Caucus, I certainly understand the importance of enforceable standards. Very few people would comply if they only had to follow rules, if they were possible or if they were feasible. I want you to think back to the time when the use of seatbelts was not mandated by law. There were millions of dollars spent to educate people on how seatbelts could save lives, but still there were people not buckling up. You know why? Because it wasn't feasible, because it wrinkled up their suits, because it wasn't possible. It rubbed the side of their neck. Some people just didn't want to buckle up, and they did not buckle up until it was mandated that we wear seatbelts. And now that it's been mandated, we are saving lives. So here we are today, and we spent all this time compiling regulations that will save lives. And once again, what do we hear? If it's possible, if it's feasible, really? There is so much more stringent regulations on pro athletes. They're tested every day, and their temperature is taken twice a day. Not if it's possible, not if it's feasible, it's mandated. But that's not what Virginia OSHA has asked for. They have asked that businesses explicitly follow some simple protocols, practicing social distancing, wearing masks, and these guidelines should not be negotiated. They should not be any kind of opt-outs or anything. These regulations save lives. And following these CDC guidelines that can change from week to week, they might be good enough for some states, but you check with Governor Northam. He'll let you know that good enough is not good enough for Virginia and Virginia workers, because Virginia values their workers. Now, while I do believe that we will get through this thing together, I don't believe all of us will, because we've got a population, African American and Latino residents of the United States have been 3 times as likely to become infected as their white neighbors. And African American and Latino people have been nearly twice as likely to die from the virus as white people. Why? One reason is because many Black and brown people are essential workers. They are responsible for keeping our hospitals cleaned and sanitized. They're working in nursing homes. They're home health care workers. They're working in grocery stores, meat packing facilities. They do not have the luxury of working from home. They must take crowded publications to and from work and return home to sometimes crowded dwellings. We must do more to keep them safe at work. If Virginia truly, truly believes that Black and brown lives matter, then they will follow the Virginia OSHA requirements without any exemptions, without any waivers. Thank you.
Thank you, Delegate Ward. And we are now open to take questions from reporters, and you can direct your question to the entire group or to anyone in particular.
Hello, this is Joe DeShiel with WDBJ in Roanoke. I was just curious, wanted to ask you just how important is a consistent standard across the state? I'm sure there's some businesses that are doing a great job or doing their best, others that are not. So again, how important would a consistent standard be across Virginia? And I throw that out to whomever can answer it.
Jason, you want to take a stab at that?
Sure, I'll take a start, and then I think Debbie will have some probably idiosyncrasy there as well. I'll keep my answer as brief as possible. When workers call in or asking for advice as to how to go about a particular issue that comes up in the workplaces, their laws are complicated and workers want to have an idea as to what my rights are. Well, right now, when they call in and ask, what are my rights related to COVID in the workplace, specifically if something is going on, how can I enforce it? Well, right now, that answer, sadly, is really you can't in Virginia and in a lot of states unless something is brought up specifically by either executive order or standard, which does not exist in the other state to date. So that answer right now is there isn't an enforceable standard. Now, if we are to pass this as an enforceable, clear standard across all industries, then advocates as well as workers themselves can take a step back and say, okay, here's my rights. How do I want to go about thinking of if I can enforce them? If there's a lot of caveats, if possibles, if feasible, then workers are not going to feel empowered to be able to speak out as to what's going on in the workplace, and therefore workers will continue to have the same issues, which is a problem not just for the workers themselves and their families, but also the public health in general. Debbie, you might have some other things as well to comment on.
Sure, I'll add a couple of things. One is, I think what you heard here today is where there's a union, that there are better protections. So the reason, in our supermarkets, like in Northern Virginia, that workers got masks and face shields and 6 feet apart is because of the United Food and Commercial Workers Union, and you heard from our wonderful worker from Boar's Head. But they're also, and in addition to that, there are companies I know from being at OSHA for 6 years, federal OSHA, that will do the right thing, that they know what the right thing is to do. Nursing homes will give N95 masks and fight for it and do triage to protect their workers. But there are whole industries that never prioritize worker safety. And then there are a lot of employers that are just gonna, they're just gonna cut corners. I know that from being at OSHA. And And what you have and why it's important to have a standard that every employer has to comply with in the state of Virginia is to level the playing field. So everybody, every worker has the same right and every employer has the same obligation. They can always do more. The standard is a floor. But CDC guidance isn't even a floor. It's nothing. It's out there. It's not protecting. There are 11 states where the governors have, passed executive orders because they want a statewide uniform worker protection. Virginia, by doing a standard, I think is because you have a state plan and you can do it, and you have a wonderful staff at Virginia OSHA and the Department of Labor in your state, provide assistance to employers and provide enforcement when it's needed is really important. And I also think it'll keep COVID-19 from really rampantly spreading back up in Virginia.
So Doris, I wanted to ask you.
I lost you.
That's good.
Oh, I lost you. What was the question?
So Doris, I wanted to ask you, one of our readers asked, is this standard have the exact same rules for every kind of business, or are there some differentiations between businesses and what they need to provide?
Yeah, there are differences like high risk, medium risk, and low risk. So there are like different categories and stuff for workers. For example, maybe you worked in an office and you never were on the shop floor. Maybe that, your guidelines, your standards is different versus from the person that's actually on the shop floor. So there are different categories, high, medium, and low risk. So, but the key thing is for people to know what they are too, like to know who's high, to know who's medium, to know who's low. And even if you're a low risk employee, you really should at least be made aware of what guidelines and standards are. Because I can remember, the many times that I've had to go out on the shop floor. So I may have been in the office, but I still had to go to the shop floor. So I just think we need to really get this right now.
And again, another question that we've gotten here is, what are going to be the repercussions for workplaces that don't follow the standards? Are they going to be fined, or what would happen? So maybe Debbie, would you answer this one?
Sure.
Debbie Berkowitz.
Yeah, hi. So the way it works whenever you have worker safety requirements is that OSHA first has to come do an inspection, and it would take OSHA like 120 years to get into every workplace once. So now they're mostly probably will focus on where there are a lot of outbreaks to just make sure the employers are complying, and also where there are deaths and and follow up on worker complaints, because what's happened is workers filed complaints and then nothing happened. And so now at least something will happen. And yes, employers, if they are, refusing to implement the basic standards in this ETS, which are not onerous and nothing you haven't heard of or thought about, and nothing that is, shouldn't be implemented, they could get a citation. And, OSHA fines are relatively low, and they're even lower for small businesses. But my sense is that the state, as usual, will focus enforcement on big workplaces and very high-risk workplaces.
Excellent. Do we have other questions from reporters? We do have a question from a viewer asking us, what can ordinary people do to help get these standards passed? And I think the main thing is to communicate appreciation to the governor. He's really taken leadership on this, to thank him for that, and just urge the entire board to make sure that we don't allow a choice of a CDC suggestion as compared to a standard. We need an enforceable standard, and we can't just ask employers to follow the guidelines of the CDC. It's really not enough. Okay, so I've got a question also from one listener is, how can these standards help teachers feel safer about going back into the classroom? So I wonder if either David or Doris wants to answer this. David, do you want to take a stab?
Yes, I will answer that. One thing that I just think is that we just need to know what's being done. We need to know that safety isn't going to be put on the back of teachers. We need to know that we will have what we need to stay safe. We need to know that students will be coming to school wearing personal protective equipment. We need to know that teachers will have what they need. And I would say those are the big things. We just need to be given assurances that yes, we will be given the things that we need in order to be safe. And we need to know that these guidelines will be followed, these guidelines will be upheld. And so that is kind of how I would answer that question.
Excellent, excellent. So we have a question about how do these standards affect testing? Jason, do you want to answer that? Do these guidelines say anything about testing?
That's an excellent question. Maybe, Debbie, you may have dug a little bit further in terms of testing. Do you have a specific comment on that? I defer to Debbie on sort of the technical pieces of this.
Debbie Berkowitz.
Yeah, I had to unmute myself. All right. Every now and then my computer goes dark. So, testing is it's not something that is required in this standard that would come out of, it really should be a federal responsibility to coordinate testing. I think testing is really important. This standard does talk about what if the results are positive, then what you do, which is really important, that workers know if there are cases of their coworkers having COVID-19. It talks about, if somebody is positive or if somebody's been exposed, what you need to do. And I think that is all very important. But as in terms of requiring testing, I do think that among the highest risk workers and in meatpacking workers, and you've heard workers, is they want to be tested and they want it tested rapidly. And there's a real failure, I think, here of the federal government in terms of testing. I myself was tested last week, 8 days ago, and I still have not gotten my results. So you can see how testing is breaking down, which is why, and sorry I'm going on so long, but it's why you need protections to prevent the spread of COVID-19 at work. Because if you can keep it and mitigate the spread at work by giving nursing home workers the right protective equipment and triaging sick patients from healthy patients and other measures, and the right protective equipment, and keeping other workers 6 feet apart, and the governor's put everybody in a mask, which is so important because it protects you from and the ability to wash hands repeatedly. I mean, this is basic stuff that's not required right now. I think that goes a long way to making workers feel safe.
Jason, can you tell us, when is the next meeting of the Virginia Safety and Health Codes Board? What exactly is that board? And can people watch and listen to their meeting?
Yes, they can. And I'm sure our communications folks can post the link up there. It's on the Virginia Town Hall. The Virginia Safety and Health Codes Board is appointed by the governor. They're making decisions relating to the regulations and standards of the Virginia Occupational Safety and Health Program, our state plan. The next meeting, as I mentioned, which is the fourth meeting, and we hope to be the final one where they pass the standard, is this Wednesday. I believe it starts at 9:15 a.m. We'll see how long it lasts. Each one of the meetings to date has been a full day, and we commend the board members for taking the time to go through the important amendments and really get things right. Because as we mentioned, if we're going to make this a clear, enforceable standard across all industries, we want them to as they have been, taking the thought to be able to get it right. So they've been debating amendments back and forth, coming to compromises, and we anticipate that the final session will be going through the final amendments, as well as hopefully getting to the final vote on Wednesday.
So Jason, another listener asked, who's on this board? And who have they heard from in this whole process?
Yeah, it's a great question. So the board is composed of folks both on the industry side, on the employer side, as well as on the worker side, labor representatives and workers, as well as employers, folks that are industry folks, as well as 2 members of the government. They've been sort of going back and forth, debating, and really folks bring differing perspectives. And I think that that's what will give them the opportunity, especially even within this emergent time, because oftentimes there's a much longer, elongated public comment process, but there's a reason why there are abilities under the law to have emergency standards. It's made just for times like this. And so they're going through the process. There was over 3,000 public comments given during the period of commenting time. There's folks on the board across all spheres and industries, and that's why we believe that they've had the time and capacity to push this forth, and on Wednesday, hopefully to get it passed and start protecting Virginians immediately.
Awesome.
No,
Go ahead.
Yeah, so I just want to add the fact too that they've had 3 meetings. They've been 8 hours each, so that's already like 24 hours. And then they have the meeting coming up Wednesday. There's an urgency here, I think, with this. We need to get it right, but at the same time, we really need to move on this. We're getting a second wave of this, if people haven't really noticed. I went and looked, and just in the past week here in Virginia, we've had over 5,540 cases in 7 days. And we've had 115 deaths in the 7 days. So it's important that we get these standards in place now so we can start protecting workers, their families, our communities, so we can be that far ahead when that second wave really hits us here in Virginia. We need to make sure with our teachers, as David talked about, like with the fall. So there is this urgency, and I would just really want people to understand that as well, that we need to get this right and we need to do it now.
So I want to ask Delegate Ward, what do you think the passing these standards means for Virginia? And do you agree with Doris that we need to move these standards along quickly? Yes, you're unmuted. Oh, you're muted again.
Okay, I believe we need to move as quickly as possible. Just as Doris said, we're hitting another wave right now, and we've got to have standards, because if we just have suggestions or people doing whatever they want to do, that's what they will do. We've got to have something in place to make it absolutely clear. This is the way we operate in the Commonwealth of Virginia. And as I said, we are not like everybody else. We were doing just fine for a while because our governor took the lead. And he also believes that just good enough isn't good enough for Virginia. And what we mean is making sure that the standards, the regulations are absolutely clear, and that those who are not following those guidelines, they will see some type of repercussion, or they will be at least cited for it. But yes, if we don't have the guidelines in place, it's almost like the Wild West. Everybody does whatever they want to do.
All right, so you mean the standard, if we don't have the standard in place,
Yes,
right?
yes, yes. Mhm,
Yes.
the standard.
And again, you mentioned earlier that there's some real racial disparities in terms of who's getting sick and who's hurt. And is that really why the Black Caucus has taken a pretty strong stand in support of these as well?
Yes, yes, that is one of the reasons why. And you see that, as a matter of fact, in the beginning, they were not giving the statistics as far as ethnicity when the counts were given at first during the governor's briefing. And the Black Caucus decided we need to find out exactly what that racial makeup is, because we understood that so many more African American and Latina people were dying. And we found out that for the most part, they were essential workers. They were right there on that front line. And as we've already heard, they had no guidance, no personal protection equipment, nothing. They were just thrown out there, fend for yourselves. And so that's when the Black Caucus took that step and decided that we were going to make sure that all of our workers, Black and brown individuals, had a good chance of making it through this pandemic just as anyone else. We already had some pre-existing health conditions perhaps, but that's not the main reason. There were so many of us on that front line without the luxury of staying home and working from home. They had to be out there. And even getting to work, you had to take public transportation. And so we just knew we had to do something to protect us.
All righty, so I think we are about ready to close unless there's other questions from reporters. I do want to remind people that this, the fourth meeting of the Virginia Safety and Health Codes Board will meet this coming Wednesday. They will look at this question of whether or not we're going to have CDC suggestions versus the question of, are we going to have a real enforceable standard? And we are hopeful they will come to a final vote this Wednesday so we can move this along quickly. We need this now. I think you've heard from our speakers that we desperately need such a standard in Virginia. And so we're going to close now, but if any of the reporters have additional questions, want to be connected to any of the speakers, please contact Roberta Oster or Destiny Levere, and they will put you in touch with them. And we thank you very much for joining us today.
Thank you, Kim.
Thank you very much.
Thank you.
Thank you.
And I'm sorry for being late.